This group of sessions is intended to describe the strategic planning for anesthesiology theory exams. I know I am dealing with a diverse population, people doing MD anesthesiology, DNB anesthesiology, diploma in anesthesiology, and it's not a uniform pattern of questions. So the strategy will slightly differ depending on which university or board you are taking your theory examination. But yes, there are some fundamental things which are common to all. So I'll try to address that. Of course, we'll have some discussion on specific question papers because a question paper as a whole um, will give you some messages like how it has to be approached and all. So definitely we'll take some questions from the previous questions of national board, various universities and all. So today being the uh, first session, let us discuss something on the strategic planning because this is a postgraduate education, right? So I don't want to spoon feed with the answers. If this is the question, this is the answer, like that. I don't think that is proper. So what we'll discuss is we'll take some question papers and decide what exactly is in mind when an examiner set the question, or what should be in your mind, because you have more control on your strategy rather than the examiner's strategy. So the more you familiarize with these questions and the strategies, and probably we'll discuss a few more additional topics related to each and every question or their topic proper, which will be helpful for your OSCE sessions and Viva sessions as well. At the outset, I would like to bring to your attention one educational camp I attended while I was in Standard 10. That actually included various activities. One of the activities post lunch was this. All the students in that group were distributed one question paper each. Okay, just like an application form, one form, like that. You have to fill in the spaces. And then the teacher announced that whoever brings it back properly, the first will be the winner. So people started answering. They have started answering like they were simple questions like what's your name, your father's name, your age, class, your state, your nation, and there was a space to affix a photograph also. If you don't have photograph, just draw a line diagram, something like that. So people were very busy filling these blank spaces. And after some time, people started giving the filled performer back to the instructor. The instructor had a smile on his face. So after collecting everything, he asked how many people bothered to read the instructions before starting with this exercise. Of course, nobody read that. Actually, the very first instruction was return this without writing anything. Okay, you are not expected to write anything, just return this. No need to write anything. So that was the very first instruction. So that goes without saying that none of the students bothered to read the instructions. So all of us were really ashamed that we never bothered to look into the heading or read the instruction before starting from the question number one and then proceeding to two, three, like that. So this is an important instruction because every exam, probably if you are writing a board exam or something, if you have, say, paper one exam, some other category of students might have paper four exam. By mistake, if you happen to get paper four exam, who is going to recognize? You are the best person to recognize, and you should do it at the earliest. This is the message from this activity. So whenever you get a question paper, read through the heading and make sure that this question paper is appropriate to your exam and it's appropriate to you. Okay. So you need to start reading the instructions very carefully right from the beginning. Make sure the subject and the heading is appropriate. And if it is having more than one paper, make sure that all the questions, all the pages are printed correctly. If it is a printed question paper, because suppose paper 1 and 2 are pages 1 and 2 are printed and paper 3 is page 3 is missing, are you going to report it to the invigilator after 1.5 hours? He might take another 20 minutes. So whatever is the problem, detect it and announce to the or inform the invigilator at the earliest. That's going to save you time, because the finishing time of the exam is usually consistent. So the time lost in between, you are the sufferer. So make it a habit whenever you get a question paper, read the title, you read the subject, and read all the instructions. Whatever 30 seconds, 40 seconds you are spending might be very vital to your score. Again, in the beginning of exam, you should be in a sort of meditation mode, because as your mind is very much relaxed, there are lots of advantages. Okay, there is no advantage of jumping into the answers right from reading the question number 1. So be in a meditative form, meditative mindset, or be calm and cool. So then only whatever you have invested into your library will be coming out when it matters. Okay, relaxation is important from your academic point of view, learning point of view, your training point of view. Imagine there is a library which gets flushed with new and newer books of various category every time, and you are not giving any rest or time to the librarian. So what will happen? The librarian will not be able to get you the book when it is required, because librarian know that it is there, but I don't know whether it is in the first floor, it's in the second shelf, 18th shelf. He is confused. So eventually you will not get the book. Similarly, if you keep on reading one topic after another, one topic after another, keep like that, when something is asked specifically, if you want to get it back, you should give your brain and mind enough rest. And at the beginning of the exam, this phase is very important, because it's technically allowing your librarian to locate whatever you have learned, so that whenever you are asked a specific question or specific topic, he will come back with that appropriate literature or book. Correct? So in the beginning, be calm, be cool. And it is a good practice to, I've already mentioned, know the rules and regulations, the duration. Yes, if it's a 3-hour exam, make sure it's 3 hours written over there. 100 marks, total marks, make sure. And marks division, we'll discuss. Read the instructions, and we have to discuss further on the time management. So it's a good practice to read through all the questions. Suppose you have 10 questions with sub-questions. Reading through without struggling to find the answers or solutions, just read through the questions in the beginning. You might spend 60 to 90 seconds or even 2 minutes for that. But the thing is, even if you find 1 or 2 questions little tough, or some topics you wanted to read, you wanted to clarify, but somehow you couldn't, or something that you never read, all these might give some little upsetting moments to you, but make sure you're cool and calm. What I intend to say is, you basically rely on this part, right? Your conscious mind. This is your conscious mind. Conscious mind. But the bigger portion, the iceberg, actually is the subconscious mind. You don't know from where the subconscious mind registers information. It could be from your class, it could be during a case that you attended, it could be from a conference or an interactive session, it could be from a webinar, it could even be from a live class like this. You would have heard about a particular topic somewhere from some source. That will be there. Probably if it is appealing during that time, even if your conscious mind won't register, your subconscious mind might register it. So as and when, suppose you had a tough question, let's say question number 7. As you keep on answering in a cool frame of mind, question 1, 2, 3, 4, 5, something will start ticking. Because by the time you reach question number 7, some or other idea might come to you. That's the advantage of these quick rates at the beginning. But remember, it has to be done in a cool frame of mind. If you start becoming upset, you will not be able to dig out information from this layer to the conscious layer. Unless it comes to our superficial layer or conscious layer, it won't come through your pen and paper. It won't come through your verbal output or the answering during your viva. You need to keep the water level or the level, cool level. That is very important. So keep cool. This is going to help you. Again, regarding instructions, say for example, national board exams, theory questions. Now they have designed the answer sheet such that question number 1 can be written only in answer sheet page number 1 to 5, 2 in 6 to 10. Like that, every question there is a designated set of pages. So if you happen to start your question number 1 and flows over to page number 6, will you get credit? Very unlikely, because the question number 2 might get evaluated by a different examiner who may even be blinded on what exactly is the question number 1. So when he sets page number 6, he will find something else written. Maybe on page number end of the page number 6 or page number 7, the question number 2 starts. So whatever you have written up to the start of question number 2, you won't get credit. So you have to plan accordingly. For national board students, make sure you write within this designated pages for each question. Suppose you are writing question number 7, pages 31 to 35. On top, it will be written space for answer to question number 7. So there is a designated place. You need not search around for this. Every page on top, it is printed. The advantage is, if you are not sure about, say, question number 1, 2, and 3, you can start from question number 4. Only thing is you need to turn pages to page number 16 and start writing question number 4. Then if your best answer is question number 9, turn to page 41 and start answering question number 9. If you leave 44 and 45 pages blank, that also is fine, because question number 10 can be started only from page number 46. This is one advantage of designated spaces. But yes, if you have a habit of padding up of your answer with unnecessary things, you may not find it enough. So good practice is make your answers small and tidy and concise to the point, because nowadays the answer keys are very specific. You will not get any credit for unnecessary padding of answers. That's a fact. So given that you have only pages 1 to 5 for question number 1, read the question number 1, see how many sub questions, and then plan your answer, then start attempting. That 20 seconds or 10 seconds you are taking to plan your answer is going to help you a lot. Answering questions in the sequence as in question paper is a general rule. Okay, you write question number 1, then proceed to question number 2, 3, like that. So whatever you write, you make sure that you have a margin in the question answer sheet. Write question number 1, and if there is a sub question labeled as A in the question paper, then start answering. It is also a good habit, because some examiners like putting something like a subheading. Okay, say adverse reactions of epidural morphine. Just write 1A, adverse reactions of epidural morphine, and then start answering. So there is no confusion which question you are answering. It's not like you write here 1 and start answering something, and then one line space, and then you start answering the second sub-question, you are actually challenging the examiner to delineate this is for sub-question A, this is for sub-question B. Don't give extra tasks to the examiners. Okay. Be examiner friendly. So whatever you are writing, the question number and sub-question number should be clearly written. Okay. Another strategy is some people say answer in the order of your expertise. That's also fine. It's only a matter of personal choice. But there is a risk. Suppose you are answering the question number 3 right from the beginning, and it happens to be not a satisfactory answer. Actually, what message you are giving to the examiner is my best answer is not up to the mark. So that risk is there. But yes, depending on your examination pattern and your personality, personal preference definitely matters because you are all doctors specializing in, say, anesthesiology. You're all grown up people. You can have your own philosophy. And these are all just broad guidelines. Whichever appeals to you, whichever impresses you or suits your purpose, makes you comfortable, you can follow that. Okay, but this is important. Question number and subsection should be legibly, clearly written on the left side margin. Short running title is a good habit. Diagrams and flowcharts whenever necessary. So unnecessary diagrams, you might spend more time. Okay, my personal preference is if something you have asked about, say, a definition or the advantages, or you want to fortify it with a diagram, you can draw it quickly with a pencil and move forward. And towards the end, if you have extra time, then go and beautify this diagram. But if the question itself is about, say, diagram of brachial plexus, you need to spend time, need label diagram, and it should be clear. The clarity is going to get you the marks. Highlighting color addition, it's a matter of personal preference. Personally, I would advise you to go for this coloring. Some people have the habit of using different colors. If you're fluent in it, it's okay, but check for the instructions whether that is acceptable or not for that format. That is very important. And preferably, if it is acceptable and you want to do it at the end, towards the end when you have extra time for this beautification. Now we will see different kinds of questions. Here you can see this is an MD anesthesiology question paper with 10 questions. You can see 10 questions, and most of these questions are structured. Okay, structured means there are different subsections, and each subsection is awarded marks separately. So for this question, writing on Malempati, the maximum score is 5. Archie Brain is 5. Here also different subsections. Subsection A has 2 components. 2 plus 3 is mentioned here. Again, second subsection also 2 plus 3. Okay, so the total is 10. That is one message you need to take. So 10 into 10, 100 marks is our business for this question. Paper 1 usually is for the basic science. Some of the question papers will have it mentioned clearly, basic science, physics, and all. But being a clinical specialty, you can always have overlap. Suppose here you can see management of PONV. This can be a clinical question. This can be attributed to basic science also because it involves the pharmacology, it involves the physiology, pathology, like that. So don't think that paper 1 cannot have other questions. Okay, here you can see perioperative uses of ultrasound. Usually we expect in the paper 4, critical care and recent advances. So there is no hard and fast rule. It's a way the examiner interprets. Okay. So toxicity of amide group of local anesthetics, no point complaining because it's a pharmacology topic. Alpha 2 adrenergic receptor agonist, 5 marks. Again, it's a pharmacology topic. Describe epidural space and its contents. It's an anatomy topic. Yes, it carries 5 marks. Okay, so one message is right from paper 1, anything is possible. And being familiar with the exam pattern or question paper pattern is important. That's what we also try to do during these sections. So now time division. 3 hours is 180 minutes for 100 marks. So generally people think it's 1.8 minutes for each mark. But I would say you just keep last 20-25 minutes apart for there are lots of other things like their quick read in the beginning 1 or 2 minutes. Towards the end you need to do a quick review of your answers, so keep 150 minutes. You target 150 minutes for 100 marks. Then now it boils down to say 1.5 minutes per mark. Okay. And you need not be doing it in a mathematical precision manner. You can say 10 marks or 15 minutes for 10 marks. So each question I proceed every 15 minutes. This is a rough guide. Even if you exceed into 16th minute, don't get upset because some questions you might finish in 11 minutes, 12 minutes like that. But this is general rule. So rule of thumb is every 15 minutes, one question should pass. So last 20 to 30 minutes is for reviewing, making sure that your pages are in right order. And of course, you need to make sure that you have written your register number or roll number. Because if you don't write that, whatever you have secured by your hard work may not be registered against your number or name. So this is very important. Before submitting the answer sheet, make sure that you have written your roll number or register number in the exam. So keep that 20 to 30 minutes buffer because sometimes in 15 minutes you may not finish a question. Okay. Or while answering question number 8, some idea struck on maybe giving an extra point or one more comparison point in say question number 4. So you can go back to question number 4 during this last 20 to 30 minutes. During last 20 to 30 minutes. It's not wise to trying to finish it in 179th minute, which is not a good strategy. This is another set of paper. Again, this is MD anesthesiology paper. Here, as I mentioned, they have mentioned the topic history, basic sciences, and equipment. But again, it can overlap into any topic. Okay. So here it is mentioned compensatory mechanisms in metabolic acidosis. Probably you can expect it in critical care or paper 4. It can be a basic science question as well. So the delineation is different. Here what you see is there is an essay question, the question number 1, which carries 20 marks. And then short answer questions, each for 8 marks, 8 into 10, 80 marks. So grand total is 100 again. Again, as per our calculation, essay, you can spend the first half an hour. Okay. Again, you need to address each and every component. Here it's mentioned, describe the anatomy of the cerebral circulation with a diagram. And it is specifically asked, you have to place a diagram there because there will be subdivision of marks, which unfortunately is not mentioned in this question paper, but definitely most of the examiners will be provided anatomy, probably say 3 marks, diagram 2 marks, like that. And then next part is describe the effects of intravenous and inhalational anesthetic agents on cerebral circulation and intracranial pressure. Okay. So after you read this question, is there any point sorry, spending time writing on the hemodynamic effects? No. The question is specific. IV, inhalational agents, CNS effects. That is clearly mentioned cerebral circulation effects and ICP effects. And again, there is another sub-question, describe the mechanism of cerebral autoregulation. So apparently you will feel that this is an essay question, but to me, this is a structured essay. Okay, because there are probably 3 or 4 parts and each subsection is clearly defined. So once you understand the structure, you create something called mind map. Okay. You need not create a mind map because mind map is actually the question itself. So one part, anatomy of cerebral circulation. Then I need to place a diagram. If I am not sure about a diagram, leave a space because definitely there is a scope for even a rough diagram, which the time I'll be utilizing is the last 20 to 30 minutes. Yes, next part, IV inhalation agents, cerebral circulation, ICP effects, and then I'll add a short note on the mechanism of cerebral autoregulation. That'll complete my essay. The whole exercise might take around 25 to 30 minutes. If I am not finishing in 30 minutes, I need to be slightly concerned. Probably I'll try to wind up the essay at the earliest and then proceed to question number 2, pray like that. And again, now there are 10 more questions, right? 8 more questions. So 15 minutes for 10 marks is 15 minutes, correct? So 15 minutes into 8 is almost 2 hours, correct? So 2 hours plus 30, 2.5 hours, and plus our buffering time. The start of time, the cooling time, the mind map time, and towards the end, the mop up time, and the verification of your register number, roll number. So this is how you divide the time. Definitely you keep in mind that paper 1 can have question from any topic because concept wise or basis wise, fundamentals wise, anything can be interpreted as paper 1 and vice versa. So whatever you think is too basic, say adrenaline receptors, can come in paper 4 as well. Correct? So this is another MD anesthesiology question paper. Here again, the pattern is different because here you find straight away 10 marks question. Luckily, it's 10 into 10, 10 marks into 10 questions, right? But this looks like an essay question. Physical principles of intraarterial pressure measurement. They haven't given a so-called mind map. So 10 marks, how much time you are going to spend? It's 15 minutes. So quickly create a mind map. And probably in the introduction itself, you can write it like a flowchart and then you can start building on this. So that will give an idea to the examiner that you have an organized answer to be presented. Coming to question number 2, it's clearly mentioned the first subsection carries 3 marks, then 2 marks and 5 marks. So 2 marks question, no need to elaborate too much. What is the cerebral perfusion pressure? So define it, give the formula, maybe give the normal formula or target. That's it. You proceed to the next subpart. So what are the factors that can affect CPP? So if the mark defined is 2 only, don't spend too much time because as per our precision calculator, 3 minutes. Okay, 2 marks is 3 minutes. So similarly, you can find, say in between again, you get a 10 marks question. It's a short essay kind. Describe the anatomy of paravertebral space and explain the technique of paravertebral block. So probably anatomy, say 4 marks and the remaining 6 marks. We don't know it's 4 plus 6 or 5 plus 5, but definitely you need to address this. Okay. I don't know whether you will have a ready-made diagram available for paravertebral space, but if it is there, the anatomy questions, you can fortify it. But if it is not specifically asked, don't spoil your peace of mind with that. Go ahead with the answers. So here, 10 questions, 15 minutes each question. So 15 minutes into 10 will consume 2.5 hours plus. So remaining formalities, another 20 minutes. That's it. Your exam gets over. So now broadly thinking, how should your answer script look like? So if you are an examiner, you need to look, the answer sheet should look neat and tidy. Okay. If somebody comes to your study room, don't you like it to be neat and tidy? Yes, the same thing. You need to disclose or declare your philosophy in anesthesiology by providing a neat and tidy answer sheet. Okay, there should not be too many crossings, too many corrections and all. So plan your answer and then proceed. Then of course it should look neat and tidy. Only disadvantage with anesthesiology is most of the institutes, they have electronic medical records. So People are not used to sitting and writing for 2.5, 3 hours. That is one disadvantage. But yes, you can, while you are studying, you are preparing for your theory itself, you keep on scribbling. So your muscle memory, your hands will know that you are expected to keep on writing for 2.5, 3 hours. So this is the funda. Your positive approach should be reflected on your answer sheet. Organized flow of answers. I have already mentioned you can either write in the question paper order 1, 2, 3 like that. See, if you want to place an excellent answer from your side in the beginning, that also is fine because it's only a matter of personal choice. Bullet points and flowcharts are always better because examiner need not struggle to find whether you are actually placing those answer keys in your answer. So don't expect the examiner to be a fisherman digging around in the sea of words or essays to find whether you have actually mentioned the actual dose, the adverse reactions, the special precautions and all. Whatever you is asked in the exam, in the question paper, you analyze it and project it clearly. If you have a clear answer, I think there is no need to struggle, but sometimes out of compulsion, if you are not sure about the answer, you might take the other way around. But definitely, this clarity of answers, clarity of communication with the examiner is going to fetch you better marks. No padding up of answers. Most of the question paper instructions are mentioning about this, and some of the question papers I have mentioned the padding up of answers may be counterproductive. So that is again a warning to you. So be careful if you are writing things which are not asked for in the question paper. So whenever you are asked for diagrams, don't expect the question setting examiner to ask you specifically to label it. It's your responsibility to label the pertinent parts. If you are asked to label specific part, this definitely you need to oblige. Even otherwise, if it is a diagram of say epidural space, so you write, place a diagram and label it neatly so that you are actually communicating something to the examiner. So examiner will reward you with a better score. Why should you go into the previous questions? Trending is very important. It's not only in the field of fashion or technology. Previous question papers do matter because actually the previous question papers will give you an idea how the examiners plan to evaluate your theory knowledge through the questions. So what are the questions recently asked, or is there any new kind of philosophy? So you have, say, for example, you have read about morphine, but the question happens to be on epidural morphine. So next time when you read the pharmacology part or the basic science part, you read specifically for that question also. So broadly also you should know, specifically on epidural morphine also you should know. So actually a kind of um, study using the question papers will enlighten you better, enlarge your domain. So that will give you more familiarity with the pattern. Like in your question paper, you are likely to come across 1 or 2 essay questions or subdivisions may not be there. You should have your own mind mapping. All this information during your training, the practicing, it is there. It's going to help you because subconsciously you will be in a better settled manner. So that's exactly the idea of this anesthesiology theory course in anesthesia tools. We will try to go into question papers, how to analyze the questions. So as I mentioned, I'm not going to give you a copycat kind of this spoon feeding kind of answers to the questions. What exactly is meant from this particular question? What exactly you are planning to or you are expected to place on your answer sheet? That's what we'll be discussing. Of course, for a generalized discussion, I might discuss some extra points also. So don't think that I am supporting the padding up of answers. No, because next time the question may be slightly different. Because same set of things you can be asked in your OSCE session or Viva sessions. So you can always fish out for more information in and around the question. So that's the idea. That's how this course, anesthesiology theory in anesthesia tools, is conceived. So we will go into the questions, the pattern, what is in examiner's mind, what should be in candidate's mind, and together we'll formulate familiarity with the trend with the previous question papers. As I mentioned, different universities, national boards, and national board and all different pattern of questions, but theory we are discussing is common to all. It's only the pattern difference. So definitely I'll be discussing some questions from national boards, some questions from other universities for MD questions and diploma anesthesia questions. So generally, I think it's going to be useful for all because we are actually exploring into the answering philosophy to theory questions.